that frees up the operating rooms at Common Spirit facilities to do things that really need to be done in the hospital, and will make things more efficient for those patients that do require more complex open vascular or cardiac procedures.
I appreciate the investment you guys have made. I want to give each of you about a minute and a half to just your closing thoughts on this, and then I want to come to you, Mark, on the closing thought on where the location is and when you expect to open. So, Dr. Feuer, why don't you put a bow on some of the comments you've made here today, and any advice you want to put out there for your referring providers? Sure.
Just for the referring providers, just know that all three of us are always available either through EMR chat or by text or by phone to discuss cases if you have any concerns. We're often willing to just give you advice. Some patients don't necessarily need to be seen by us right away, but we can also give you guidance about what imaging studies might be necessary before they see us.
The very latest on economic development, workforce, and industry sector news in Southern Colorado. Here is Business Digest Weekly with our host, Dirk Hobbs.
Good Friday afternoon, ladies and gentlemen. Welcome to Southern Colorado Business Forum and Digest. This is the Business Digest Weekly here on AM 1460 and 101.1 FM here in Southern Colorado. Glad you're with us. I took a quick break over to South Carolina to see my 94-year-old dad. So he is up and moving around and doing just fine. Spent Father's Day with him, so that was a lovely thing to do. And, of course, South Carolina did not disappoint with the heat and the humidity. And, of course, we got to know some of the local wildlife there. We stayed out on Seabrook Island close to Kiowa, and it was an absolutely beautiful time away. So, but good to be back in Southern Colorado. I love landing in Colorado Springs on a direct flight from anywhere and not having to go through the Denver ordeal. And then when you step off into the gateway and you come into the terminal, your skin just goes, whoosh, it just dries right up, and it's brilliant. I love that feeling. So anyway, good to be back in the chair here, and good to see and hear you guys out there in the world. Some news on our front. We have recently relaunched the Colorado Springs Independent. It is now going to be called the Southern Colorado Insider, and we're honoring some traditions because that publication was here for about 30 years. It did an incredible service for a lot of folks, inspired a lot of our conversations here in the community for better or worse. But we're going to take the publication a little bit different direction. I think folks are a little fried on how things, how our public discourse is going. So we're going to tone that down a little bit, and we're going to focus on the things that we're doing really well here in Southern Colorado. And we're going to wrap our arms around Pueblo and Canyon City and a few other communities around the region, Castle Rock, Woodland Park, Monument, Falcon. And we're going to talk about arts, entertainment, and what makes us tick here in Southeast Colorado, because there's a lot more than just our politics at hand. So we're going to have a broader conversation about different people, what they're doing out there, what they're making contributions to our community, and how they're advancing us all forward. So anyway, it's good to see everybody again. I've got some great guests. I want you to lean into this conversation because we have two phenomenal guests here, and it's very rare that you get a 1-hour consultation with not one, but three cardiovascular experts. And I'm just skimming over the surface. I mean, there's a lot more to these three, and we're going to find out who they are, what they do. They're with a group called Southern Colorado Heart and Vascular. And you'll know them by a couple of names, and we're going to clear that up here in just a minute. So if you know Colorado Springs Cardiology, a lot of the same folks there. We're going to kind of glue all those pieces together for you, and then we're going to have a robust conversation around some of the things that they're seeing on their front. And if you're a business leader like me and you work all the time and you're stressful and maybe you're sedentary, I want you to hear these guys out. Okay, so let's talk to them before we actually need their skills in the OR. So glad to see you guys here. We'll get back to you in just a minute. But I also want to encourage everybody to go out and get your latest Business Digest and CSBJ. Of course, if you recall, we did purchase the Colorado Springs Business Journal a couple months ago, and we have integrated it into the folio. And now we are covering everything from South Denver Tech Center to Trinidad, Canyon City to Kansas. So basically the entire southeast quadrant of the state. This is our economic development and business conversation around all the industry sectors and the workforce that we have going here in Southeast Colorado. And we do cover a lot of the medical industry in this as well. But, of course, advanced manufacturing, cybersecurity, and aerospace and defense, and a lot of our other subordinate industries here, amateur sports, hospitality, industry as far as hard manufacturing is concerned, infrastructure and energy. Put all those things together for a more robust discussion for venture capitalists and site selectors to look into this region and see that we actually are a business-friendly universe down here. One of the things that struck me about a month ago was how a lot of people kind of freaked out when they saw how far Colorado Springs in particular had fallen off the list for one of the best places to live. It went from number 3 to number 406 in U.S. News and World Report's findings. Now, a couple of things came into play. U.S. News and World Report added or opened that survey up to another 800 communities. So it used to be a certain tier level that they would evaluate, and those same cities would kind of rotate through based on some of their economic performance, workforce performance, and other infrastructure components. However, they let 800 other communities in this, and so by extension, we fell from that. But there's still some legitimate concerns. Our public safety is one of them. The community has grown a little restless, and we are working on that from a public safety standpoint. There's legislation that is not business friendly. There is a lot of, sidestepping you have to do and hoops you have to jump through to get through credentialing processes, whether you're trying to set up a business here, greenfield, infield, whatever it is, and you have to go through all this permitting and all this stuff. The city of Colorado Springs is working very, very hard to streamline that process. So efforts are being done. But our discourse in the community has not been terrific. And a lot of times when you hear Colorado Springs on the news, you're hearing about a really big bust, something to do with guns and knives and some other drama out there, or some other vague or ambiguous reference to us. The bomber up in Boulder apparently had a residence down here. So, of course, we got lumped into that conversation. So if you listen to the national news scene, no matter what you listen to, you're going to hear Colorado Springs in those lights. So we're here to debunk, not debunk, I mean, those things do happen, but they happen in every major U.S. city. We're the 42nd largest GDP in the United States. We're going to have our share of problems here. But what we're also seeing is a lot of this industry sector development here that gets hidden under that other messaging. And so that's what we're here to do, is focus on that. So if you want to know what's going on with economic development, growth, workforce, education, preparing our workforce for the next generation jobs, what's going on in our healthcare infrastructure, things like that, take a look at the Business Digest. And of course, our North Edition has Hale Irwin, who's the honorary chairman of the U.S. Senior Open here in Colorado Springs. Just a few short days away. I'm excited. Any of you guys going? No? You want to go?
I'm not a golfer.
You're not. You don't have to be a golfer. All right. Well, let's get to the point as to why we're here. We have Dr. Christopher Kovach. He's to my right. He is an interventional cardiologist and endovascular specialist at the Colorado Springs Cardiology. And then we have Dr. Danielle C. Smith. She's in the middle here, a vascular and endovascular surgeon at Colorado Vascular Associates. And Dr. David Feuer, vascular surgeon and endovascular specialist at Colorado Vascular Associates as well. And then soon we'll meet a gentleman named Mark Baker. He's the Ambulatory Surgical Center administrator for this group. First of all, good to have you guys here. Welcome.
Thanks for having us.
Thank you.
Really appreciate you being here. And I look forward to this conversation. So let's start with Dr. Kovach. Just kind of give us a quick background, executive summary, where you're from and how you got out here to Colorado Springs, all the way from Alberta, Canada.
Sure. Yeah. Thank you so much. Thanks again for having us on. So, I grew up in a military family. My father was a fighter pilot for the Canadian Armed Forces. So I had the privilege of kind of growing up all over the world, in Europe and Canada and the United States. And I found myself going to college in the States because my dad had been posted down here. And, like all tales, I met a lovely woman, and she became my wife, and we have a family here.
Nice.
And she joined me on this medical journey. So as you had said, I'm an interventional cardiologist and an endovascular specialist. So I bounced around, did some of my training at Denver, went to University of Washington in Seattle for interventional cardiology,
Very
and then
good.
on to Rhode Island for vascular training. So it's been a real privilege to bring my family here about a year ago and join the team and kind of work to build something really special here in Southern Colorado to take care of folks with peripheral arterial disease and all sorts of other vascular diseases.
Very good. Welcome, Dr. Kovach. All right, Dr. Smith, where do you hail from?
I am from the great state of New Jersey. I did move around a fair amount due to joining the military. So I ended up doing my residency in Hawaii, which was really difficult.
Yeah, I'm sure.
So I did my general surgery with the Army in Hawaii. And then I did end up in New York at New York Presbyterian, Cornell, Columbia for my vascular surgery training.
Wonderful.
And then I spent most of my military career stationed in North Carolina. And similar, but in a different category than Chris, than Dr. Kovach, I met my husband, who was also military and was previously stationed here. And so once I finished my service with the Army, we moved out here about a year ago to settle down and raise our boys.
Very good. Is he also with the Army, your husband?
He has retired, but he was in the Army.
Very
yes.
good. Was he a specialist of some kind?
He was a Special Forces soldier.
Wow. God bless you both. Thank you for your service. All right, Dr. Feuer, last but certainly not least, where are you from?
I'm also originally from New Jersey, a small town named Hightstown, just outside of Princeton, by the university. And I did my medical school in Brooklyn, New York, and residency and fellowship in New Brunswick, New Jersey. As an undergrad, I got the opportunity to do some research out in the Mountain West and fell in love with this part of the country.
Yeah.
So I worked deliberately and slowly to get my way out here, and I've been living in Colorado since 2008, practicing for the previous 10 years in Pueblo, and when this opportunity came to join these two up here in Colorado Springs, I jumped at the chance.
Very good.
I also met my wife here in Colorado, and she's originally from Idaho, but it was living and working in Castle Rock. And so at the time, Pueblo and Castle Rock, Monument, Colorado was the midway point. So we bought a home in Monument back in 2017. And when the opportunity came to join this group, it was a no-brainer. It was a great group of people in the perfect location, and I couldn't be happier.
Well, thanks to the three of you for being here. I know this is very expensive time away from the office, but I do want to give you guys the mic for the next 3 quarters and just kind of let you unpack some of the things you guys are seeing and what you're doing in your clinics, and some of the new modalities that we can talk to and share with the people kind of on a granular level, but also like our referring physicians out there to lean in and listen to this as well. Because these guys are going to be having some insights that you can certainly appreciate when you're having patient encounters that may be presenting with certain dynamics that may be best in the hands of these good folks here. All right, so stick around. I want to encourage the website, covascular.com. Check that out. Bring that up while we're having this conversation, and we'll get back to work here in the next quarter. Stay tuned.
My experience with Colorado Springs Orthopedic Group has been top-notch. The whole orthopedic group, they've worked very well together. Even when I've gone through PT or needed to get my collar prosthetic, everybody's been just right on top of it. It's all centralized and the communications have been awesome. Even though I had my nervousness about going into surgery, I was still very confident. I knew I was going to be okay. Colorado Springs Orthopedic Group is definitely getting me back to my life and the things that I want to do.
All right, we're back here, second quarter, Business Digest Weekly on a Friday afternoon. You are just 90 short minutes away. Actually, about a little more than that, hour and 45 minutes away from your first cold toddy of the weekend here in Southern Colorado. Anyway, glad you're with us. Listen in. If, the statistics are still holding out that probably 1 out of every 2 of us are going to experience some type of heart or vascular related issue. And obviously, we'll get into the details and stats here in just a minute, but I want to encourage everybody to go to the website right now. It's covascular.com. covascular.com. And another website that you can pull up, they're kind of coexisting right now, is coscardiology.com. We're in the process of kind of merging all those sites together because this large physician group has come together, and they're putting all these modalities to work for us here in Southern Colorado. But every time we have a conversation like this, it really comes down to our lifestyles and the choices we make. Some hereditary components to it, definitely, but early detection and screening and awareness about cardiovascular disease and how it takes form, how it takes shape in our unique bodies, that is something that I always want to promote awareness around. And who better to talk about this than folks that are helping people get out of the trouble they found themselves in. And a lot of it is preventable. Not all of it, but a lot of it is preventable. So we've slimmed down the room here by one physician. He'll be back a little later to talk about something else, but we're going to focus on something called PAD. It's peripheral artery disease, and I'm going to let these good folks talk about it. Dr. Feuer and Dr. Smith, welcome back. Glad you're here. I'm going to give you a lot of runway here to talk about all of this stuff. So let's start with the basics. PAD, what is it? How do we end up there?
Sure. Peripheral arterial disease is basically hardening of the arteries, atherosclerotic plaque that builds up in the arteries wherever they may be, and that can be in the neck, in the heart, in the abdominal aorta, and the lower extremities. And as you hinted at earlier, lifestyle plays a big role in these things, as does genetics. Mm-hmm. The biggest risk factors for our patient population, number one, of course, is smoking, and that's always a challenge, getting our patients to give up their tobacco. Mm-hmm. And then high cholesterol, high blood pressure, and diabetes. And so our lifestyles can play a big role in whether or not we get peripheral arterial disease and how severe it is when it's finally diagnosed, and mm-hmm. and what the outcomes will be. So that's a conversation that's always going on in our offices with our patients.
I bet. Dr. Smith, you want to add anything on to that?
Yeah, so while the lifestyle and risk factors can kind of put you in this category of peripheral arterial disease, what it also means is that you can help slow that disease process or even stop it if you do quit smoking, if you're able to get your diabetes and sugar under control, and if you make those kind of lifestyle exercise changes and really get up and moving and have a walking program and some sort of plan, and that can make a significant impact and potentially avoid having to see us for a surgery or an intervention.
Mm-hmm. Well, you mentioned something there, the other comorbidities that come into play here, and obviously diabetics are one of the primary mm-hmm. candidates that you see aligned. Those comorbidities are kind of glued together. One feeds the other. Is that a fair assumption? Unpack that a little bit and how that works, maybe.
Yeah, so they both can target the blood vessels. Smoking typically will affect some of the larger blood vessels, so more kind of from the knee up mm-hmm. Or the groin up, and whereas diabetes can attack those smaller blood vessels, so more so the knees down, those tiny blood vessels in the feet, and sometimes the arteries to the kidneys, which then also involves folks on dialysis or with kidney disease. That also is a big impact on peripheral arterial disease and outcomes.
Very good. Now, when you say smoking, obviously tobacco smoking is one. So that's pipes, cigar, cigarette, marijuana, anything else that they might be smoking. Does that include vaping?
I think any form of nicotine intake is going to be detrimental in the long term So we try to get them to avoid it in its entirety if they can.
Mm-hmm. That behavior is really tough to change. I mean, all right, so we're in a consultation with you here. Let's say we're a little bit on the front end of this. 35-year-old male, female presenting to you, and they have a history of it in their family. Maybe they're a little overweight, got a stressful job. Where would you take this conversation?
Well, my first conversation would be you can't really control your genetics, but you can optimize the outcome. And one of the ways to do that is to eat a heart-healthy diet. Heart.org has some great resources for that.
Very good.
But basically, it's a low-fat diet, avoiding fried foods. Even when you get your protein sources, your meats, try to lean more towards the leaner meats, chicken and fish. Mm-hmm. Eat a lot of fruits and vegetables. And eat a variety of foods in a variety of colors.
Okay, not a bad idea, and very pleasant to look at. So a lot of, I've actually been in front of primary care specialists who have said, "I wish there was statin in the water." Are we still kind of in that mindset right now, or what do you think about that disposition?
Well, I think statins can be very beneficial, and of course they've got the data to back it up, which is why we use them. Mm-hmm. But there is a role for, again, diet and lifestyle in being able to kind of manage cholesterol and other things associated with that, with just your own diet and choices. Mm-hmm. So it's a great attribute that we can use to further improve cardiovascular health. Plaque stabilization, particularly in patients with peripheral arterial disease. But, it's not the end all be all. I don't think we all grew up with a statin deficiency.
Right. Well, exactly. Very good.
And I completely agree. I mean, obviously, if you cannot control your lipid profile with diet and exercise, then statin therapy becomes really important as well, mm-hmm. and can significantly reduce the risk of heart attack and stroke. It can stabilize whatever plaque is already existing in your arteries and prevent that plaque from rupturing or increasing in size too.
Any advancements on how those formularies are interacting with the liver now? I mean, are they less, I guess, impactful or negatively on the liver?
The newer generation of statin drugs are a little bit less impactful on the liver, but it should always be obviously administered under a doctor's supervision.
Of course.
And the effects on your liver profile and also any side effects of those medications should be discussed with your doctor, because some people unfortunately cannot tolerate statins, and there are other options for those patients. And there are some newer drugs on the market that are really helpful for people who have really recalcitrant hyperlipidemia, such as Repatha, which is an injectable drug, which has some excellent long-term results as well.
So somebody finds himself in front of you, say midlife. They've clearly got some calcification going on. Is that reversible at this point, or are we too far downstream? I mean, what's that conversation look like?
People have done studies on children and have found that fatty streaks have developed in their arteries even under the age of 18.
Interesting.
And a lot of that has to do with our American eating habits, mm-hmm. but a lot of it also has to do with genetics. Unfortunately, there's nothing available currently that will remove plaque from a vessel medicinally. Mm-hmm. I wish there were,
yeah.
And if there were, I'd be an investor.
Same here.
I do think that our bodies are made to heal, mm-hmm. but they have to be under the right atmosphere and circumstances. And so, again, the choice of lifestyle, diet, activity really will make a difference. And that's the hardest part, though, for people to want to change or to be able to change, because food and other things are, they can be an addiction. Mm-hmm. And so I don't know if we can really reverse plaque completely. I don't know if we'll ever know that, because there probably isn't a study that could evaluate it. But I do think that optimizing your health and your body's ability to heal can make, the world of difference.
Right. And obviously a healthy lifestyle makes that a greater possibility. As cardiovascular surgeons, I mean, at some point you've got to be like, gosh, we have really got to change mm-hmm. the paradigm on how we think about our food intake and nutrition, and how we are very sedentary in our lives right now. You see it all. You see the best and the worst of it. I want to come back and I want to give you guys a little more time and then we'll get Dr. Kovach in here as well. But I want you to unpack a little more about advanced stages of PAD and kind of the worst case scenarios and what we can hope to avoid. So maybe a little scare tactic strategy here. I don't know, but certainly a warning to get the people to sit up and take notice of what we're doing here. All right, we're back in a moment here with a specialist over at Colorado Vascular. Be back in just a moment. All right, we're back here, third quarter. Listen in, folks. We're talking to the experts over at Southern Colorado Heart and Vascular. I want to give them their URL real quick. So covascular.com, or you can check them out also on coscardiology.com. So the whole practices are coming together. Those websites are basically going to get you to the same place. They have 4 great locations here in Southern Colorado. If you're looking for a phone number, 719-960-0363. Of course, anything we talk about here today need to do with the consultation and direction of your primary care physician as well. So don't act on your own. Get some clinical advice and understanding of what your specific situation is. And then hopefully we can avoid seeing these folks, except for maybe on the radio. But if you end up in their office, this is the conversation I'd like you to hear. So Dr. Smith, we were talking about PAD and peripheral artery disease in kind of as it advances and gets downstream, things tend to get a little bit more serious.
Right. So, I mean, the prevalence of peripheral arterial disease is high across the country, but even here, so in Colorado, where we tend to think we're in a healthier lifestyle and a healthier population, but the reality is it's probably underreported or underappreciated.
Okay.
There's many folks, and for the most part, by the time patients make it to one of our offices, they're at high risk of major amputation, meaning a below knee or an above knee amputation, with or without an intervention from a surgeon or interventionalist. And so, what really matters is what's the goal then from our standpoint as the provider, as the doctor. Mm-hmm. And it's really limb salvage. So that's what we're creating here is this multidisciplinary limb salvage team. And the goal of that is not necessarily that you won't lose anything. I mean, hopefully we can prevent any amputation, but a lot of patients will still end up with a toe amputation or even a midfoot amputation. But that functional outcome and quality of life is so much better than a below knee or an above knee amputation. Mm-hmm. The mortality rate, the 1-year mortality rate for a below knee amputation is probably 30 to 40%. And on that higher level, if you have the comorbidities we previously discussed. Mm-hmm. Now, once you move that out to 3 to 5 years, particularly at 5 years with a major amputation, your mortality rate is 80-85%. And that's higher than most cancers, metastatic cancers. So it's really imperative to, again, get in early to see us and have this multidisciplinary team where we're not just improving the blood flow, but we have every factor involved in limb salvage to optimize outcomes and patient care.
And that's part of why this team has really come together. And you 3 make up the entire team, or are there other specialists in the group?
Well, we are the 3 that are going to be working on taking care of arterial disease in the abdomen and lower extremities and in the neck. The cardiologists are also working on coronary disease. Dr. Kovach does both, and then his partners in our group also do the interventional work for cardiac disease, and then our cardiac surgeon partners can take care of the disease that needs surgical treatment in the heart.
And beyond the interventional and surgical team members, right? We all perform procedures to kind of restore blood flow to an artery that's severely narrowed or blocked. But that team for limb preservation and limb salvage really starts to blow up and become a much bigger picture, because that team also involves the primary care doctor, a podiatrist, endocrinologist and diabetes care, orthopedic surgeons, and all sorts of other specialists who come together. And so, when we talk about limb preservation teams, it's really a multidisciplinary approach that allows patients to have the best potential outcome by combining all of this knowledge and all of this expertise, because no one physician or subspecialty really has the entire skill set to provide the breadth of care that is needed by these kinds of patients.
No question about it. Well, folks, they've got 4 locations, as I mentioned earlier, and I want to come back to the conversation here in just a moment, but I want to make sure our entire regional audience understands. If you're in Canyon City, St. Thomas More Hospital, there on Fay Avenue, you can definitely come into contact with the group there. Southern Colorado Heart and Vascular on Haley Lane, down in Pueblo West, and, of course, the 2 campuses up here in Colorado Springs, Woodman Medical Plaza and Union Medical Campus. All right, so talk to the referring providers here for a minute. We've got a patient presenting. I mean, what's the conversation need to be between their crew first and you, because they're traditionally reaching out to you first, and then what's the conversation look like? What do you want some of these primary care providers to be looking for in these patient encounters?
Well, some of the subtle signs of peripheral vascular disease may be loss of hair below the knee and the legs, even in patients who don't have any other symptoms. They may be walking just fine and not noting any symptoms. But if symptoms do develop, they may notice that their calf muscles fatigue more easily when they're going for a walk, and they're not able to walk for as long a period of time before they need to stop and rest. And it may even feel sort of like muscle cramping. And those can be some of the earlier signs of peripheral arterial disease.
Okay.
I think it's really important to stress, too, that for certain kind of patient subsets who have a lot of risk factors, diabetes comes to mind, that, stressing the importance of kind of routine examination of a diabetic foot exam, because sometimes some of these folks, as diabetes becomes more advanced, people lose sensation in their lower extremities. And so things that seem that they could be otherwise minor, like a small scratch or an injury to the foot from walking barefoot in your yard or what have you, can turn into a non-healing wound because of the underlying peripheral arterial disease. So I think primary care physicians and podiatrists can help have a high degree of surveillance and monitoring for this, and connect these folks with us early in that presentation so that we can offer them more options than in kind of the extreme late stage that, like Dr. Smith was talking about earlier.
Mm-hmm. Is it ever too late to get started? So let's say you got a patient presenting who's got some, they're clearly downstream with this. They've got some calcification. They may have some peripheral artery disease. And is it your recommendation that they can start to take control a little bit now? The sooner the better, or unpack that a little bit?
It's never too late.
Okay.
The reality is your risk of amputation or your chance of successful revascularization and limb preservation, that will probably go down the later you are in your disease process or in starting to change some of your risk factors. Mm-hmm. But it's never too late. And if you don't do anything, then you're almost certainly going to end up with a major amputation.
Right.
And I just wanted to add just on what Dr. Kovach was mentioning for our multidisciplinary team, a really major player for us is also our wound care team, because they do a lot of the behind the scenes work before and after the revascularization. And they help, guide when patients do need either their first intervention or potentially another one to help optimize limb preservation.
Very good. So from the team perspective here and developing this interdisciplinary group here, are there some new tools available to you that you guys are talking about and utilizing on a regular basis? And how would you want to convey that to the public and to the referring community?
Sure. Yeah. I think that the breadth of the tool set for intervention for arterial disease has become enormous, I would say, over the last 5 to 10 years. And so in addition to all the surgical techniques, there's all sorts of tools and equipment that we use in our labs. So we use drills, we use lasers. Well, I think one of the most interesting and transformative technologies over the past 5 years has been something called intravascular lithotripsy. So this is basically a balloon that you inflate inside the artery, and then the shaft of the balloon actually has ultrasound emitters upon it. Mm-hmm. And so then once you activate this balloon, it actually emits these ultrasonic waves that help to fracture and break apart calcium. A lot of really advanced arterial disease has heavily calcific walls, and that can make it really tough for us to deliver the kind of end result that we're looking for. And so I think for me and my practice, those kinds of tools have been a complete game changer, because it's really opened up a lot of other options for the minimally invasive treatment of arterial disease that might otherwise have necessitated more invasive procedures.
And the field of treatment of vascular disease has really undergone a sea change over the last 25 years. When I came out of my fellowship in 2000, 90% of what I was doing to treat arterial disease and aneurysmal disease was open surgery. And I'd say it's almost exactly the opposite now. About 80% of what we can be treated with minimally invasive, often outpatient techniques in an ambulatory surgical center or in the hospital setting if necessary. And when it's appropriate, that's our first line go-to for most of our patients with PAD who do require treatment. There are some patients, due to the extent of their disease or other comorbidities, where open surgery is still appropriate. Of course, we still perform that, but we're able to provide the length and breadth of the treatments that are available for our patients and tailor it to their specific needs.
Very good. And what's the communication cycle look like between your practice back to the provider, primary care? Because that's always that continuum of conversation and the continuity of care is a big deal these days, especially with all these EMRs and patients not really understanding what you're saying sometimes.
Yeah, that's a big part of the multidisciplinary approach. And, what brought me here to this practice and what really excites me about this practice is the willingness of all parties to really want to collaborate to optimize patient care and outcomes. And so, I know we like to keep an open communication between the three of us, but also among the primary care providers, any referring providers, and again, all of the team members involved, podiatry, infectious disease, wound care, et cetera, for these patients. They do often have a lot of medical issues and other doctors that they're seeing, and it can be confusing. So the provider team, being in contact and kind of on the same page is really helpful for the patients who, often needs direction or us to reach out and let them know what the next step is.
As part of that, as part of our growth our growth plan as a practice, we will be incorporating a nurse navigator into our practice.
Excellent.
To help coordinate and communicate appropriate medication changes and management for our patients for the long term, to help reduce the risk of need for either amputation or reintervention. Mm-hmm.
Yeah, and then in addition to that, Dr. Smith and Dr. Feuer and I participate and provide consultation on a weekly limb preservation meeting that we hold with our wound care partners and podiatry partners and others to talk about new patients who are coming who have presented, to talk about the timing of intervention, because in some circumstances these things can accelerate in unpredictable ways, and also to make sure that after we have provided the aspect of care that we provide, that these folks are on the right trajectory to recovery, so that we can continue to work together to get them the best outcome.
Very good. All right, we're going to come back to this conversation and then learn a little bit more about their ambulatory surgical center here in just a moment. Check them out online, covascular.com or coscardiology.com, same place. Basically, 719-960-0363. We're back in a moment with these three terrific physicians.
My experience with Colorado Springs Orthopedic Group has been top-notch. The whole orthopedic group, they've worked very well together. Even when I've gone through PT or needed to get my collar prosthetic, everybody's been just right on top of it. It's all centralized and the communications have been awesome. Even though I had my nervousness about going into surgery, I was still very confident. I knew I was going to be okay. Colorado Springs Orthopedic Group is definitely getting me back to my life and the things that I want to do.
All right, back here, fourth quarter, Southern Colorado Business Forum and Digest. Glad you're with us. If you want to see this on podcast, make sure you check out Spotify. It's Business Digest Radio on Spotify, iHeart, and Apple Playlist. You can go out there to YouTube as well and look up Southern Colorado Business Digest. We'll have this interview for you in its full presentation, so you can take a look at what we've talked about here and what we're about to talk about in the next few minutes. So I'm going to give these guys plenty of room. I'm going to get out of their way, but we've got Southern Colorado Heart and Vascular team in here. Dr. Feuer is in the room. We also have Dr. Kovach, and now we have a new guest in the middle. She had to step out for just a moment, but we have Mr. Mark Baker. Sorry.
That's all right.
Okay. Mark Baker. So we're going to take that Brad out there, Mr. Producer. Mark Baker, Ambulatory Surgical Center Administrator here for Colorado Springs Cardiology in this new vascular group. So, Dr. Feuer, I want to kind of start this last section here with how the practice in this combination of experts is coming together and how that's going to manifest itself in the physical form, if you will.
Great. One of the reasons I was so excited about joining this venture is because of our plans to build an ambulatory surgical center off of Interquest, which should be going live hopefully by the end of this year.
Excellent.
And what that physical space is going to allow us to do is to perform outpatient vascular interventions and procedures for all of our patients, along with outpatient clinic follow-ups and non-invasive imaging surveillance for our patients who do have disease that either may one day require intervention or that has already been intervened upon. And that allows us to also collaborate whenever necessary with one another to make sure that our patients are getting the optimum care.
Very good. Dr. Kovach?
Yeah, for me, and I think for this team, I think that this is an amazing opportunity. I think as you know, healthcare costs in our country are ballooning out of control. And, I think ambulatory surgical environments offer an interesting opportunity to offer patients a higher quality of care with the convenience of a local location and same-day discharge, while also lowering healthcare costs overall.
This is in contrast to the hospital setting.
Yeah, exactly. Right. So I think in contrast to the hospital setting, where I think there are different factors that combine in that interplay. And so very exciting opportunity to be able to bring this kind of multidisciplinary practice in an ambulatory environment, which is new across the country, and it will especially be new and I think impactful here in Southern Colorado.
No doubt about it. Well, Mr. Baker, welcome to the program. We didn't get a whole big intro with you, but this is going to be your baby from an administrative standpoint. How are things shaping up, and how are things coming along so far?
The construction is going well. Everything's being designed with the future in mind, taking care of patients, but we're also looking at what's on the horizon, those new procedures that are being moved by CMS from the hospital setting to the ambulatory surgical setting. So when those procedures are approved, we will be able to move forward and get those out to our patients in a very quick manner. The Ambulatory Surgery Center, as my partners were talking about, we can do things much cheaper, much sleeker. We're also more focused on this specialty. So we're not competing with orthopods and these other things in the area. So when our patients come in, they feel like we're paying direct attention to them. They're not part of a much larger herd, I guess, of patients, for lack of a better term. And they feel like we're really focused on them and what they need. And we're doing it cheaper because we don't have all of that excess overhead like a hospital does.
So when you say cheaper or less expensive than an OR setting in a hospital, what percentage-wise, what are we talking about here? 30%? Less expensive, 50%? What are we talking about?
It depends on the procedure. So there's a lot of subjectivity to that.
Of course.
But things like a heart cath may cost, CMS may say, that they'll pay $5,000 for it. In ambulatory surgery center, that same diagnostic heart cath may only be about $1,600.
Very good.
So there's quite a bit of savings for CMS and insurance companies. And that just makes everything go much, much smoother.
Right.
We're a lot more dexterous, agile in the way that we can do things.
A lot more nimble for sure. So when you are working with a health system, it really behooves them to sit up and take an interest in what you guys are doing. I know you do a lot of work with Common Spirit, but you're really open for business on all fronts here in the region. So when that comes to pass, it really behooves them to take a look at that, and maybe they can allocate some of their funding that's putting into the ORs now elsewhere into the system, right? But for heart and vascular in particular, I mean, if you guys are able to look at things through that lens and help reduce costs, I mean, that's a pretty substantial contribution.
Yeah. Historically, what a lot of health systems are seeing is these independent ambulatory surgery centers may have initially pulled some of that ambulatory business away from the hospital, but then on the other end, they actually saw an increase. Because of the referrals back when
that's correct.
When we found more serious disease, things that weren't appropriate for the ambulatory surgery center, those patients got referred over to the hospital. So there is actually a benefit to hospital and healthcare systems for ambulatory surgery centers.
Absolutely.
Yeah, and as our surgical center opens, we're going to maintain. We're very strongly motivated to maintain strong partnerships with Common Spirit, and so I really view this as an opportunity to extend our care to a larger cohort of patients in Colorado Springs, in Southern Colorado, and in places farther afield like Alamosa, Durango, and Dr. Feuer, you've spent a lot of time in some of the other locales in Southern Colorado as well.
Yep. I've done outreach. Well, I used to work down in Pueblo, and we did outreach in Walsenburg, and then captured stuff from northern New Mexico and Trinidad.
Oh, very good.
And so, there's a large rural population of vascular patients that get referred our way. And instead of them having to come into an inpatient setting for procedures that can be done on a same-day basis, they can be done on an outpatient basis. That frees up the operating rooms at Common Spirit facilities to do things that really need to be done in a hospital, and will make things more efficient for those patients that do require more complex open vascular or cardiac procedures.
I appreciate the investment you guys have made. I want to give each of you about a minute and a half to just your closing thoughts on this, and then I want to come to you, Mark, on the closing thought on where the location is and when you expect to open. So, Dr. Feuer, why don't you put a bow on some of the comments you've made here today, and any advice you want to put out there for your referring providers.
Sure. Just for the referring providers, just know that all three of us are always available, either through EMR chat or by text or by phone, to discuss cases if you have any concerns. We're often willing to just give you advice. Some patients don't necessarily need to be seen by us right away, but we can also give you guidance about what imaging studies might be necessary before they see us. And then we're also happy to do long-term surveillance for these patients with vascular disease that have either been treated and need surveillance or may eventually need treatment but don't need it currently.
Very good. Dr. Kovach.
Yeah, I just remain so excited about the opportunity that we're growing here. And, in conjunction with my amazing partners, I really have just so much faith that with multidisciplinary teams that we can improve patient outcomes and offer folks a really high quality of care by combining minimally invasive approaches and surgical approaches in our ambulatory environment in a way that genuinely I think is going to be new and to Southern Colorado, and offering services in such a way that have not been available here before. So we look forward to talking to all of our referring physicians and seeing patients and partnering with the community.
So this is a fairly new concept, this particular dynamic that you're assembling here?
For our group is a multi-specialty involving cardiology, cardiac surgery, and vascular surgery, pardon me, which is not new, but it's rare.
Yes.
And I think the collaboration that we're able to develop with one another is going to provide for the optimal care for our patients.
No doubt about it. Well, Mark, bring us home on this. It sounds like you guys are making great progress. Where is it going to be located? And then all the good contact information for it.
Okay. It's going to be located 10600 White Diamond Point.
Okay. And give us a big cross street to where that might be close to.
It's behind Icon Cinemas.
Oh, okay.
Yeah.
So it's up here on the north side.
Voyager and
Okay. So Interquest and Voyager.
Interquest and Voyager.
Very good. So close to the new Interquest Hospital here for Common Spirit.
Fairly close, yeah. Yep.
Okay.
Yeah.
And construction, you're dialing in here?
Yeah. So construction's moving right along, and we're looking at hopefully being able to get our certificate of occupancy in towards the end of November.
Okay.
And we'll have to do some initial cases for all of our certifications and licenses, and then we will be, pedal to the metal. We'll be able to go and start taking all of our patients in and using the facility.
Very good. And the other specialty groups, credentialing pretty streamlined, pretty efficient process for orthopods and other specialists to come in if they're needed?
Yeah. I mean, once we're up and going, then it's pretty easy to add any specialists if we needed to.
Very good. All right. Any closing remarks for the folks out there? Really appreciate you guys coming in. I know you're busy men and women, and thank you, Dr. Smith, for being here as well. We appreciate you. I know you had to take a phone call. Let's put it on that. But really appreciate you guys coming in here and kind of unpacking this very unique multi-specialty integrated group. And you're serving the entire Southeast Colorado region, which is pretty special. So thank you for coming.
Thanks so much for having us.
Really appreciate it. All right. We've had Dr. Christopher Kovach, interventional cardiologist, an endovascular specialist with Colorado Springs Cardiology, Dr. Danielle Smith, vascular and endovascular surgeon at Colorado Vascular Associates, and of course, Dr. Feuer, David Feuer, who is here he's a vascular surgeon and a vascular specialist at Cardiovascular Associates as well, and of course, Mark Baker, Ambulatory Surgical Center Administrator for this brand new group here coming up. Well, they're not a new group, but they're going to have a new center here up on the north side of Colorado Springs. They do have 4 offices throughout southern Colorado. Be sure to look them up online. Colorado Vascular or covascular.com or coscardiology.com. Phone number 719-960-0363. Thanks for listening to us today. We're back next week with some more business insights and economic development news. We've got an economic forum coming up. Want to make sure you have an opportunity to get to that with UCCS. All right, folks, have a great weekend. Take care.
You've been tuned in to Business Digest Weekly with Dirk Hobbs. If you'd like to be considered for a spot on our show, email us at info@coloradomediagroup.com.